Top 50 NCLEX Practice Questions 2026 for USA nursing students. A client with septic shock is receiving norepinephrine via central line. Which finding indicates the medication is achieving its desired effect? Correct answer is B. MAP increased from 55 to 68 millimeters of mercury. A nurse is reviewing labs for a client with liver cirrhosis. Which result explains the client's increased bleeding risk? Correct answer is C. INR 2.9. A client with chronic kidney disease receives morphine 4 for pain. 30 minutes later, the nurse notes shallow respirations. This reaction is primarily due to. Correct answer is D. Reduced drug excretion. A trauma client develops hypotension, jugular venous distension, and muffled heart sounds. Which intervention is most appropriate? Correct answer is B. Needle pericardiocentesis. For contrast reaction, stridor plus hypotension. First action? Correct answer is C. Administer epinephrine. Severe ARDS. Which ventilator strategy improves oxygenation and reduces injury? Correct answer is C. Permissive hypercapnia. Heart failure client on digoxin. Which combination suggests toxicity? Correct answer is A. Hypokalemia plus nausea. A client with increased ICP develops widening pulse pressure and irregular respirations. This indicates. Correct answer is C. Cushing's triad. Massive GI bleeding, metabolic alkalosis occurs due to. Correct answer is B. Loss of HCl. TBI client, unequal pupils plus declining LOC, immediate medication? Correct answer is B. Mannitol. Pulmonary hypertension client, sudden hypotension plus tachycardia. Most likely med involved? Correct answer is A. Sildenafil. Paradoxical chest movement after trauma. Priority intervention? Correct answer is B. Positive pressure ventilation. Which task may be delegated to an experienced UAP? Correct answer is C. Daily weight on HF client. A client on TPN develops hyperglycemia. Anticipated change? Correct answer is B. Add insulin to TPN. A postoperative client reports calf pain and warmth. Priority action? Correct answer is C. Measure calf circumference. Which finding suggests ventilator-associated pneumonia, VAP? Correct answer is B. Purulent sputum. Gastroparesis in diabetes is caused by dysfunction of which nerve? Correct answer is B. Vagus. Which breathing pattern occurs in metabolic acidosis? Correct answer is C. Kuzmol. After naloxone administration, resedation risk occurs because. Correct answer is B. Naloxone half-life is shorter. Which client should receive discharge teaching first? Correct answer is B. Stable angina on beta blocker. Septic shock trends improve. Which best indicates improved perfusion? Correct answer is B. Decreasing lactate. A client on warfarin has sudden headache and vomiting. First action? Correct answer is B. CT scan without contrast. Ventilated client, hypotension, unequal breath sounds, high pressures. Priority? Correct answer is C. Prepare chest tube. Liver failure client confused. Which lab explains this? Correct answer is C. Ammonia 94. After 4-furosemide for pulmonary edema, which confirms effectiveness? Correct answer is D. Reduced preload. DKA glucose drops rapidly after insulin. Priority concern? Correct answer is B. Cerebral edema. Polymorphic VT with prolonged QT, likely cause? Correct answer is D. Ondansetron. Autonomic dysreflexia suspected. First action? Correct answer is B. Check bladder. Post-op client needs first ambulation. Nurse's priority? Correct answer is B. A client with left-sided heart failure reports SOB when lying flat. This symptom is called. Correct answer is B. Orthopnea. Ethical conflict. Family demands full code despite DNR. First action? Correct answer is C. Clarify advance directive. Which potassium level increases digoxin toxicity risk? Correct answer is C. 3.1. Massive blood transfusion causes tingling and hypotension due to. Correct answer is B. Citrate-induced hypocalcemia. Enoxaparin in acute kidney injury should be. Correct answer is C. Reduced or avoided. Which ICU client is priority? Correct answer is C. K6. 1 plus peak T waves. Which finding suggests acute adrenal crisis? Correct answer is B. Severe hypotension unresponsive to fluids. Sepsis client shows decreasing PaSiO2 with worsening acidosis. This indicates. Correct answer is C. Impending respiratory collapse. Myasthenia gravis with respiratory difficulty, anticipate. Correct answer is B. Pyridostigmine. Which change requires immediate provider notification? Correct answer is B. Sodium drop 136-128. Hepatic encephalopathy worsening despite lactulose. Priority? Correct answer is C. Protect airway. A client with cardiogenic shock is on dobutamine. Which assessment best indicates improved cardiac output? Correct answer is D. Urine output 20-45 milliliters per hour. A client receiving continuous renal replacement therapy becomes hypotensive. Priority action? Correct answer is C. Temporarily stop CRRT. Ventilated client, high pressure alarms, diminished bilateral breath sounds. First action? Correct answer is B. Check tubing for kinks. Acute liver failure client develops metabolic acidosis. Primary cause? Correct answer is B. Lactate accumulation from impaired metabolism. Vasopressin titration in septic shock. Which outcome confirms effectiveness? Correct answer is B. Increased SVR. Subarachnoid hemorrhage client, confusion plus hyponatremia. Most likely condition? Correct answer is C. Cerebral salt wasting. Mechanical ventilation, rising PaCO2, decreasing pH, worsening compliance. Next step? Correct answer is D. Switch to pressure-controlled ventilation. Suspected fat embolism syndrome, long bone fracture. Supporting finding? Correct answer is B. Petechiae on chest and conjunctiva. Long-term corticosteroids abruptly stopped. Which sign indicates acute adrenal insufficiency? Correct answer is C. Severe hypotension. High-dose opioids for cancer pain. Alert client reports pain. Explanation? Correct answer is A. Medication tolerance.